Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and a really great question came up this week from one of my followers who asked about kids and nosebleeds and if they need an expander for orthodontic reasons, is it okay to do the expander if the kid has regular nosebleeds? And I had to phone a friend on this one. Obviously, for me, anytime there's something medical going on that isn't in my area of expertise, I mean, obviously, my area of expertise is the mouth, and the mouth is the floor of the nose, which is related to nosebleeds, so it could be interrelated. But there could be other pathology, other things going on, and anytime you're doing a expander in a kid, it's distraction osteogenesis, which is basically breaking the jaw and forming new bone. So what if there was a polyp or pathology or something like that, and they're already having regular hemorrhaging? This could be really dangerous, you know? So the friend I phoned is also a dentist, but has extensive experience in pediatric orthodontics, as well as extensive experience working and interacting with ENTs, probably way more than I do. So this friend responded that daily nose bleeding is not normal and they need to go to their primary physician. That's the first port of call. So you start with the primary physician. Obviously, you know, you send a referral with the parent, you explain it, you do a follow-up. If you haven't heard anything back, you give them a call, you send a letter. If you're still not getting any movement from the primary, then you can always go up the next chain of command and send straight to the ENT. A lot of parents want to skip go, but we don't want to forget to not leave our primary care physician in the loop because they may already know something. Now, you also have to realize that at least where I'm from, which is kind of an arid or a dry area of California, especially during the summer, it was very normal to get daily nosebleeds. As a matter of fact, I had siblings who had them on a regular basis and they did not have any pathology because the humidity is like zero pretty much. Also can depend on if you're on any medications. There are a lot of derm medications that cause cracking and bleeding systemically, and regular nosebleeds. I believe many family members in my family had to have their noses cauterized, so that was pretty normal in our family. I don't know if they still do that. It was pretty barbaric. Other things that can cause nose bleeding could be, believe it or not, constipation, he said. That's interrelated, diet, congestion, postnasal drips, allergies can cause nose bleeding, as well as mouth breathing, having an open mouth posture, a hyperdivergent growth. But there's a lot of different things that go on that are directly and indirectly related to nose breathing. So let's see what else he said. So he said you can check for nasal patency. That's something you can do, where you basically have them close their mouth and give a puff of air through their nose and just make sure the nose is patent. That does help. You can take a lateral cephalometric x-ray to see if there's adenoids. I do have definitely a lot of content on that. He also said that within a panoramic x-ray, you can often see turbinates and septum issues. I'm not trained on that, but I do know if you take a CBCT and you send it to 3DDX or beam readers, they will do an airway analysis going into all that as long as your field is big enough. You should also give a sleep pediatric SDB questionnaire, which I talked about in the previous video, to see if an ENT is perhaps needed, and to clear any physical obstructions if it's there. Send to an allergist if needed, if it's a congestive or an allergy issue. And ultimately, it says pick and choose what they want and place nose bleeding under narrow arches. Advice to doc to stick to their guns: primary care first, ortho second. So basically physician goes first before expansion. In this case, you need to get that release and from either the primary or the ENT. So please avoid treating these patients. And if the parents can't follow the instructions and go in the right order, then that's not a patient that you want to see. So that is the answer I got, and I agree with this answer. Hopefully that helps. Thanks.